In this presentation, during the RBT training, we're going to talk about promoting yourself as a reinforcer. We want to promote yourself as a therapist to become more reinforcing to the client. Remember, this is part of the RBT training that covers the 40-hour requirement and is offered separate of the BACB. I want you to think about the following. When a baby is developing, milestones are met with lots of excitement. People clap, jump, use funny voices, etc. when those milestones are met. And when I say a milestone, what I mean is stuff like walking, or their first sound, or the first time they smile, the first time they reach for you, all sorts of these different things. These milestones, as a baby develops, when they're met, people get very excited. This encourages the baby to continue to do these. In ABA, we say we're reinforcing that behavior. So the first time a baby might smile, we're probably going to smile back and get very excited. This in turn will likely make that baby want to smile more. Remember, we're talking about development. These developmental skills will start to build upon each other. Soon, the baby will learn joint attention, being able to attend to the same thing in the environment the same that the other person is. They're basically looking at the same thing. Where they might point to an airplane in the sky or point to a car driving by. This encourages future development in social behavior. The point is, though, is that when a baby is developing, when they do things, especially meeting milestones, they're met with lots of excitement. One of the deficits that is common to autism is a preoccupation with normally irrelevant or non-noticeable stimuli in the environment. When the patient attends to the stimuli, this can prevent them from attending to relevant stimuli related to learning, social interactions, and other people. So when I say something is normally irrelevant or non-noticeable, what I mean is small little things that aren't supposed to be the main attention focus for a person. For example, a dust particle floating around in the air, a tree outside barely swaying, a string hanging down from the windows that is moving back and forth. Another deficit in autism is social deficits. Wanting to interact with people or knowing how to interact with people. So if the child is attending to all this stuff in the environment that is normally irrelevant or non-noticeable, this prevents them from attending to the more relevant stimuli, such as another person or favorite toy. In lay speak, you might say they're distracted. But I think that oversimplifies it a little bit. To the person with autism, these stimuli, attending to them, make sense to them. I can't answer you why it does, but it's part of the deficits of autism, where they have a deficit in social skills and an excess, or they do too much of, attending to stuff that's not normally relevant or stuff that's not noticeable. Another consideration that you're going to want to have is that most of the kids or most of the patients you're going to be working with have not developed what's called quote-unquote intrinsic motivation. Now I say quote-unquote because if we really want to get philosophical about this, a behavior analyst may not say there's such a thing as intrinsic motivation, but I'm using it here just to describe basically self-motivating. We have to ask ourselves, why would the person want to pay attention to me? Why would the person want to pick the correct card? To them, to the patient, learning or picking the right card may not be something that's relevant to them. If you ask most typically developing 4-year-olds to show you what they know, they're going to be excited to show you. They like their responses. People say, "Oh, you're so smart. That's awesome that you know that." To some of our patients, that may not be motivating enough. This is why we use reinforcers that are more tangible, while also pairing with social reinforcers such as a good job, so that eventually we can just use the social reinforcers. That's a very broad and general way to put it. But the point I want you to understand as an RBT is to ask yourself, why would the patient want to pay attention to me? Why would they want to get or pick the correct answer? So, by acting silly, or by being funny, or doing something different, we're going to provide a way to make yourself more noticeable. Again, quote-unquote silly is not a behavioral term. It is just something I'm using right now to illustrate. You're going to have to be something, you're going to have to make yourself more noticeable. This training I originally did as something called a silliness training. Because remember, we're working mostly with kids. They're a child with autism. They're a child first. And kids love when we act funny. They love having fun. Now, as an RBT, you have lots of competition. iPads, iPhones, movies, toys, video games, food, that irrelevant stimuli or small stimuli, the stimuli that they are tending to, such as the floating dust particle. That's your competition. For not only their attention, but how they like to have fun. So, the definition for acting silly, or again, acting more noticeable, for the purposes of our discussion here, is acting in a way that promotes the child or the patient to attend to you in a positive way, while still being able to provide clinically sound therapy. Silliness is simply a label of behavior. It is part of an enriched environment for the person, for the patient. You'll be providing a lot of attention to all of their good behaviors. So I want you to think, what makes something silly? What makes something noticeable? Because really what we're talking about here is making yourself as a stimulus more noticeable. Because remember, you are a stimulus within the environment. Our ultimate goal is to provide our clients, our patients, with clinically sound, empirically validated methods of therapy that are going to provide them with the maximum benefit. So why is this important? Well, let's talk about the definition of contingency from the ABA book. Definition of contingency It's a complete description of the behavior, its consequence, and what situations it will influence the future of behavior. But remember, it's mostly like a contract. If you do this, you will get this. Think about the contingencies operating when you work with a child or a patient. The ideal situation is that the contingency operating within the environment will affect that patient's behavior in the desired way. The most important component of the learning environment is you, the RBT. You are the one providing the enriched environment, the desired consequences, and are establishing the antecedent situations that make behavior more likely, and bad behavior or undesired behavior less likely. Your goal as an RBT is to become the SD for increased responding from the child. In other words, you want to be reinforcing to that child. When the child interacts with you, are they motivated to respond? If they are, there's likely to be fewer behavior issues and more success. In this way, acting silly or more noticeable is an within stimulus prompt for paying attention to you. You're making yourself more noticeable. You're changing something about yourself. You're making yourself more noticeable. So if you look at this picture, it's from an old children's book called Where's Waldo? In it, you're supposed to find a character wearing a red and white striped shirt that's wearing glasses. If you imagine the world of an individual with autism, there's a lot of other stuff to pay attention to. So we want to make stuff more noticeable. By having a prompt, such as acting funny or acting silly, or acting a little bit different, we make ourselves more noticeable. If we can see on the picture, it's much easier to find Waldo when there's some sort of prompt there to show where he's at. This, in essence, is why we need to act silly or act in a way that will get the client's attention or patient's attention. You're competing with a lot of other things. Acting in this way, or making yourself more noticeable, is both an antecedent and consequent strategy. Remember, an antecedent comes before the behavior and a consequence after. It is an antecedent strategy because you are making yourself more noticeable. It's kind of like a within stimulus prompt. Consequence. It's a consequence strategy because we're going to give exaggerated responses for when the appropriate behavior does occur. Kind of like you already do in reinforcement. Actually, exactly like you do in reinforcement. So why is this so important? Well, being reinforcing to the patient affords us more time to do program. Less time will have to be spent to get the patient's attention. And more learning opportunities will be available. Remember, we're trying to teach our patients as much as we can in the time that we have them. We want to take as many opportunities as we can. And it is better to use that time to teach them rather than trying to get their attention. So, what are some of the ways to become reinforcing so that the patient will respond to you? Well, the first thing is we pair ourselves with reinforcing items. We bring favorite toys. We have access to their favorite food and give it to them when they need it or want it during program. Basically, we make ourselves known to be paired with reinforcing items. Sometimes this means we might bring some toys from home. Basically, we want that individual, the patient, to think, hey, when that person's here, I get good things. Being consistent. The child knowing what to expect, the patient knowing what to expect. Getting to know the patient through rapport building and other ideas. Make sure to read the protocol about how to work with that patient. If you are new to the patient, ask around to get some tips. And remember, each patient is going to be different. So how to act to get their attention is going to depend on the patient. But definitely one way is to pair yourself with those reinforcing items, whatever that is for the person. And being consistent. Remember, when a patient touches their iPad or their tablet, something happens. It's predictable. We need to strive to be like that. Yes, over time, we may become a little less predictable, but right now we're building rapport and we're trying to make ourselves more noticeable. So we want to be as consistent as possible, and we want to pair ourselves with reinforcing items. We want to make this a lifestyle for the entire time that we're with the patient. Don't stop trying to be fun or reinforcing between learning opportunities. Always keep in mind reinforcement principles and contingencies. Listen, I know that it can be odd to act in this way around other adults or at a parent's home, but try to find a method that works best for you. I like to use silly voices or draw or sometimes sing funny songs. But basically you need to find what's going to work for you. The more you practice it, the more natural it'll become for you. Remember generalization. Once a child has a handle on previously mastered target items, work on it in a variety of fun and silly ways. For example, you might use a cup to make a hat for a character, pretending like you forgot your name and asking the child what it is. You can have scavenger hunts. Hey, go find me the cup. Go find me the toy. Go find me the Skittles. Whatever it is. The point is that we're going to try to be as fun as possible. Practice role-playing. Some children have favorite characters in TV shows. Take time to know them and maybe the theme song. Look for video clips of the characters. Try to act it out. One thing I've had to do recently is learn all about Minecraft. A lot of the patients I work with really love Minecraft, so I've taken time to learn all the different characters and kind of the stories behind it. If you find that you're spending a lot of time trying to get that person's attention, take a few minutes and find the right kind of behavior that will get them to attend to you. Once you figure it out, keep it up. Remember that taking time to do this saves time in the long run. Building a rapport, building a good therapeutic rapport, means that you won't have to spend as much time getting that child's attention. The pace for learning will be quicker. Of course, in reality, it's not that easy, and each patient is going to be different. Some, I'd say most patients aren't going to respond right away. If you're new to a case, ask others. And if you're a veteran of the case, think of some new ways to approach the therapy if the person's attention seems to be waning. It may have to be a drastic change. Remember, we don't want to keep up with the status quo if the data isn't showing progress. The important thing to keep in mind is that you want your behavior to help the individual patient to respond to your instructions and to attend to you. Finding the right way to be silly or more noticeable will not only be beneficial for the patient, it will make the session a lot more fun for you. Also, if you find something that works for you, if you find some form of way to get attention for that patient, remember to share it with other people on the team. And a very important caveat though, and something that makes this very difficult to do and master, is that it happens to have to happen in conjunction with all the protocols, data collection, and other factors of therapy. In no way should being silly or fun or more noticeable interfere with the clinical goals and protocols of the patient. If the protocol indicates that the individual should not use TV as a reinforcer, then don't do it. I am working with a patient right now who absolutely loves Minecraft, but the parent has asked me not to pretend to play Minecraft or not to pretend to be the characters because it gets the individual child too riled up. So yes, it should never supersede the protocols. And remember, while it is important for the child to quote-unquote like you, it is as equally important for you to provide strong therapy according to the plan. So don't let the individual patient get away with things they shouldn't. I think that's worth repeating. Listen, I understand you want the child to like you, you want them to be your friend, but you also have to remember that we are there to provide intervention therapy, meaning that you have to follow through with the protocols. I would practice with any kids you have in your life, your own kids, nieces, nephews, friends' kids, if you can. While it can certainly be awkward and quite a bit draining, being able to act in ways that make you more noticeable and more silly is something that will make you a more effective RBT. Basically, it just makes you more noticeable. It can lead to more attention from the child or patient and allows you to provide more therapy.